Okay, good morning, everyone. It is my honor to present our program called The Embrace, our virtual clinic model. And I am presenting this in behalf of the Embrace and Love Yourself team in the Philippines. And I have no relevant disclosures. In my presentation, I would like to have a context on why we are doing this. We would want to know the HIV epidemic situation in our country, the needs of our clients, and how to reach out to them, and providing context on why we have to improve our services. And knowing our clients' needs, how do we now create the virtual space where we can access services, and how we can respond to them, and by giving them services, understanding their different backgrounds, needs, and lifestyle. And I would be sharing some of the lessons learned that we have in the program and what takeaways that we can share for others that are working with communities. In the Philippines, we actually have a rising HIV epidemic, and as announced by our Secretary of Health a few weeks ago, we actually have a more than 500% increase as compared to 2015. If we will not be doing anything, we would be reaching around 401,700 Filipinos diagnosed with HIV in 2030. And that's what we are seeing in our diagnosed cases. Just a few weeks ago, our Department of Health Epidemiology Bureau has released that there are actually 57 Filipinos diagnosed per day with HIV. And in terms of our 95 accomplishments, we have accomplished so much, but we have to accomplish more in terms of testing and linking those who turn positive to treatment and making sure that they are virally suppressed. Even though that we have done so many things, these data testifies that we need to do more. And for us to do more, we have to understand who we are reaching to. We have to address practical and personal needs of our clients. And it's very evident in social determinants of health that social factors can contribute to an individual's risk of acquiring a disease or preventing themselves to have that disease. And what we know, HIV, we know that it's a very stigmatized disease. It is critically important for us to know that HIV services should address two needs. The first one is the practical need, where if our clients access HIV combination prevention options, that will lead them to satisfy their biomedical needs. But we have to satisfy more than that need. Our clients also have personal needs, which would guide them towards self-care and sustainability, teaching them how to take care of themselves better and love themselves better, which will lead to satisfy their psychosocial needs. And we need to understand that if we create and we innovate our services, we have to address these both needs, and these are non-negotiable. Now, understanding the two needs, how do we now reach out to the clients who we want to reach? I think in our lesson in Love Yourself is a community-based organization that's been working with providing sexual health, transgender health, and mental health services for the community. And I think it's a great lesson that we had is we know the market because we are the market. We know the interventions that we will be doing to our market because we are ourselves part of that market. And this involves the communities in creating the response, not just by helping out, but they are themselves the architects of that response. The communities can help in the creation of key messages, demand generation strategies, and designing programs to reach various target markets. And even though we are doing so much already in terms of community-based work, task shifting, and all of such, there needs to have a change in paradigm. With our current approaches, we need to reach more people, but recognizing the diversity of our clients in terms of their lifestyle, their needs, and their wants. And in Love Yourself, we ensured that we will be reaching them by ensuring these three pillars: the status-neutral approach, evocative messaging, and integrating pleasure in our approaches. The first one, using a status-neutral approach, the advancements in HIV science have brought us combination prevention. It has brought us into a time where we can talk about preventing HIV, preventing how to get it or how to transfer it. So we can talk about preventing HIV in a singular message. And this prevents the feeling of zero sorting. Zero sorting meaning we have to separate people based on their HIV status. So this approach will make us able to offer different options to our clients that would work for their lifestyle. The second approach is for us to use evocative messaging. In our line of work, we tend to categorize people as people at risk for HIV. When we discuss risk, it comes from a mindset that what we are doing is wrong. And because of that mindset, we tend to change people. Oh, don't do that risk. Don't approach that risk. So we tend to approach them in a directive way, or meaning what they should be doing right. You need to use condoms. You need to use PrEP. So that is a very directive approach. So we want to change how we deliver that messaging into delivering it in a non-judgmental manner, tailored to the specific individual on who we talk to, and offer them the options that would be best for their lifestyle. That is evocative messaging. Evocative meaning we evoke emotions and we let them decide what is best for their lifestyle. And lastly, we integrate pleasure in our key messages. Pleasure, in definition, is a feeling of happy satisfaction and enjoyment. And talking about pleasure, especially pleasure in sex, is often seen as taboo. We don't really discuss about it. But in our services, we discuss the dangers and the risk of sexually risky behavior, but we do not address or highlight the reason why people are doing sex in the first place. So I guess we need to integrate the reason, and understanding that reason, we are able to contextualize their stories and share the options that would be best for them based on their stories. And placing shame on people, especially for those who are having sex, propagates stigma. Let people be people. There are many ways we can talk about sex, and it's a natural and healthy part of us being human, and whatever sex you are doing, we need to do it safely. So coming from those 3 pillars that we did in the organization, we have to retool our thinking. Instead of thinking of hard to reach people, we should think maybe we have hard-to-reach services. And how do we now ensure that our services are easy to reach for the people who need them the most? And that space, we think, is already in our hands. We go online. And if we go online, the safe space is already in your hands. This is where we built Embrace. Embrace, we see, is a virtual presence, which is very relevant in the Philippines. Because the Philippines, our country, has a strong virtual presence with a high internet penetration rate and significant social media usage. Especially amongst gay here, if you know beauty pageants, we are, fighting with each other, and Filipinos have, that energy of having themselves online. So Filipinos have actually a high internet penetration. Around 89% of our population has access to the internet. The Philippines also ranks the highest in the Asia-Pacific region in terms of social media use. We have access on mobile internet, and we are active in various social media platforms. Understanding that context, we can now promote our services online. That's where we created Embrace. Embrace is an acronym which means empowerment through modern best practices for real access, care, and education. Embrace is an entirely virtual hub, meaning they don't have to go to our clinics. It's an entirely virtual hub in offering HIV education and testing, STI consultations, access to PrEP and PEP, transgender health and gender-affirming care, and mental health services all in one platform. And with that platform, we integrated LoveYourself's best practices, experience, and its full suite of health service delivery in rolling out these interventions online. In our experience in the organization, where I would say we have some experience in providing demand generation and promoting our services online, we gathered all of our experience into creating the Embrace Virtual Hub. We have already introduced the medicalized PrEP algorithm, which has currently 19,000 clients. We already offer online HIV unassisted self-testing, which we test around 35,000 clients per year. We already have an all-virtual PrEP service, which currently have 500 clients, and this is an entirely virtual space, whether that's for your enrollment or follow-up. And our use of influencers for demand generation has garnered monthly engagement of more than 2.5 million people. With this experience, we harnessed all of these experience to establish our entirely online virtual clinic. So how does Embrace works? It's actually accessible through Facebook Messenger, and if you scan that QR code, you'll be able to access Embrace. The limitation for that, it is only available right now in Taglish, a mixture of Tagalog and English, so you might not understand some of the words. But if you scan that online, you will be assisted by Teddy. Teddy is actually our virtual assistant who assists clients with the service that they need, and they will assist. Teddy will assist you whether you need testing, whether you need PrEP, whether you need STI consultation, or whatever service that you need. We developed Teddy from our various hackathon sessions with our clients and in our organization. And powering Teddy is a dedicated team handling client management, consultations, counseling, the logistics, the marketing, and all the monitoring. And we ensure that our team are composed of both medical and non-medical staff, which ensures task sharing and all of the things that we're doing online. In terms of lesson learned, we just started fairly new, just November 15 of last year, and in just 3 months, we actually had 282 clients. 40% of them are first-time testers. 22% of them accessed STI consultations. 31% of them accessed PrEP, and 4% of them accessed PEP. And all of these clients were directed to the service that they need, and we ensure that they are not only directed, but they are assisted every step of the way. What we have learned in our entirely virtual hub is first, user-centered design is key to engagement and retention. If we tailor our virtual experience to the behavior and the preferences of our clients, it has been proven crucial in ensuring uptake, especially among those who have been testing for the first time. Confidentiality and discretion drive utilization. If you offer a virtual space, most of them who would be accessing the service values confidentiality and discreetness in their experience. So many clients cited the convenience and privacy of virtual consultations as a major factor in accessing services. It shows that virtual models can overcome stigma-related barriers effectively. And operational integration across services, it requires dedicated coordination. Even though we have our experience in service delivery, a various set and complex coordination still needs to be done. If we offer sexual health, including HIV and other STI services, transgender health and mental health services in a single virtual platform, demands not just technical solutions, but also seamless service navigation. And how do we move forward from our experience in integrating all of LoveYourself's virtual experience into one virtual hub? Our movement forward is to expand Embrace now to include an all-virtual HIV treatment services. This expansion ensures that individuals who screen reactive can remain within the same trusted, discreet, and accessible platform for their lifelong HIV care. We need also to strengthen follow-through to all clients. This ensures proactive client navigation, follow-up messaging, and case management approaches that prioritize continuity and personalized support. And of course, we need to integrate community feedback loops because as we hear feedback from our clients, that improves us better. These will guide our platform enhancements, identify service gaps, and ensure that innovations stay aligned with the evolving needs, preferences, and challenges that are faced by the diverse communities that we serve. And with that, we thank you for listening to our story.